So in the spirit of Halloween, we're going to talk about creatures that make visits to people's homes in the middle of the night, and blood-sucking creatures like that. And so in The Wizard of Oz, they talk about lions and tigers and bears, oh my. We're going to talk about lice, scabies, and bedbugs, oh my. And so that's what we're going to discuss about, okay? So we already had some discussion about scabies since our patients have scabies, but we're going to learn a little bit more about these little creatures that go bump in the night. So scabies, they have a 14-day life cycle in the skin. So after 14 days, the scabies tend to die out because they only live a maximum of 14 days. And so they lay their eggs, and in about 3 to 4 days, they will start developing into adults. And by 1 or 2 weeks, they will actually become adults. So they'll lay their eggs, and then in about a week or 2, they become adults. But it takes 4 to 6 weeks for them to cause a reaction in the skin. So they may be there for weeks before they even cause a reaction, so they're smoldering, doing all their things. But the reason why it takes 4 to 6 weeks is because that's how long the body takes to develop a reaction to these little bugs. It takes only about 15 to 20 minutes for the bugs, the scabies, to be transferred from skin to skin. So it's usually a skin-to-skin contact, but it doesn't have to be a long exposure. Just a short time of 15 to 20 minutes will transfer the bug to the other person. Okay. Now we always talk about clothing and things like that, but it's not as common to actually transmit scabies through clothing. So usually it takes a lot of these mites to kind of increase the chances of them being transferred. And from clothing, they usually find like 1 to 15 mites in 80% of the time. So clothing doesn't carry a lot of scabies. So it's possible, but it doesn't transmit a lot because there aren't a lot of scabies in clothing and bedding. But if you look at the skin, they can have thousands to millions of scabies in the skin if there's all this crusty stuff going on. So it's usually skin to skin contact rather than from bedding or clothing. Yeah. Now, usually if they're immunosuppressed, like they're on steroids or methotrexate, a lot of the people with scabies are actually asymptomatic. And so people who are on medications, 46.7% of them will not have any symptoms of scabies. So they could be infected and yet not know they have it. People who have HIV, they're immunosuppressed, so 10% will have scabies and not show any symptoms. And then people with Alzheimer's may have scabies, but they may not actually show symptoms either, partly because they don't recognize that they're having symptoms. So a lot of our patients who may have scabies, if they don't have good memories, then they may be itchy, but unless we pay attention and watch them, they'll never complain about the itching. The common sites are the wrists and the web spaces of the fingers, ankles, armpits, buttocks, male genitals, and usually they kind of like to hang around the nipples of breasts, so the areola. Those are common places of scabie attacks. And again, if this is their first exposure to scabies, they may not have symptoms for 4 to 6 weeks. But if they had scabies and got over it, and they got exposed again, then the reaction only takes about 24 hours because it's an immune reaction. So if they saw it before, then it only takes 24 hours for them to show symptoms after exposures to scabies. The clues are usually the itching is worse at night, and if you use any topical or any kind of antihistamines or steroids or anything like that, again, most of people will be asymptomatic, so they could have scabies but not show any signs or symptoms of it. Okay. Now, if they get scabies, scabies itself doesn't do anything horrible, but there's secondary infections. So impetigo is very common after getting scabies, abscesses, cellulitis. People have even gotten rheumatic fever, which is an infection of the heart. Or they can have kidney problems because the infection goes to the kidneys, but it's not caused by the scabies. It's just that scabies opens the door and then other germs get in. Treatment, the permethrin has a 80.6% cure rate after about 3 to 6 weeks. And there are some other topical ones that are not as effective. We talked about pesticides, malathion. It only helps in 11.4%, and there's lindane, which is 29%. So the permethrin is actually still the best. It's 80.6. But there's also a lot of irritation from the medication topically. So then you may have to use steroids or something else to counteract the irritation from the medication itself. Now, in one patient, we used oral ivermectin, and in the case that we used it, I think it helped. But when they compared it together, side to side, it didn't seem to be any more effective, and maybe even less effective than the topical. Now, to prevent spread, even though not much of the scabies are in the bedding and the clothing, it's still possible. So you can kill the scabies by washing the bedding in hot water of 122 degrees for 10 minutes. Or you can put the clothing and bedding in plastic bag, and after 72 hours, the scabies will die. And then again, anybody, family members or close contacts should be treated as well. There have been 622 million cases of scabies globally in 1 year. So it's common around the world, usually in third world countries, but it's here in the United States as well. Okay. The next one are bed bugs. Now, bed bugs undergo 5 stages of development to turn into an adult. And they usually live in warm, dark environments. So mattresses, furniture, flooring, and walls are very common places for bed bugs to appear. They're usually something that you can see. So again, when you go to hotels, you can actually find bed bugs by their appearance. And they're usually about 5 millimeters, so they're pretty good size. So you can see them, on the beds or on the ground or whatever. They're usually oval shaped. They don't have wings, so if you find a bug with wings, it's probably not a bed bug. They're usually nocturnal, so if they're going to come out, they're usually going to come out at night. And they're attracted by body heat and carbon dioxide. So they're attracted by our breaths. So carbon dioxide and heat are what attracts bed bugs. So that's why they look towards humans. You'll see multiple bumps and redness and rashes and things. And usually the pattern of bed bugs is they're usually clustered together, or they will form a line. And if you look at the rashes, you can actually see teeth marks like a vampire's bite. So if you see two little scabs or whatever in the bump, it may be the bed bugs because they are biting. They're like vampires. So they come out at night. They're attracted to warm things. They suck out blood, just like the vampires. And you can probably see the fang marks if you look carefully enough. there are, the bed bugs actually, when they bite, they actually carry around 50 different pathogenic organisms in their bodies that could be transferred, but studies haven't shown that these little organisms in the bed bugs actually do transfer to their victims. Now the problem with bed bugs is that not only do they have the rash, but 50% of people actually go through post-traumatic stress, anxiety, and depression. So the worrying about bed bugs is almost worse than the rash itself. People are worried about getting bitten. And so a lot of people go through pretty severe anxiety, worrying about if bed bugs will get them or are still in the bedroom. Now usually in about a week, all the rash and symptoms just go away, so you don't have to treat them at all. But you can treat it with steroids or antihistamines just to treat the symptoms, but if we did nothing, the symptoms would just go away on its own, so you don't have to do anything. Now, bed bugs don't like freezing, and they don't like heat. So if you kind of expose bed bugs to either one of those things, the bed bugs will die. Okay. And then there are pesticides. So if you call an exterminator, they can get rid of bed bugs by using pesticides. Okay. And so again, when you travel, just look around for bugs in your luggage because you don't want to take them home, and you don't want to see them in your bed. Okay. So the reason why they're spreading so rapidly around the world is because we carry it from place to place from travelers. So those are bed bugs. Now, body lice are the other critter that comes out, and it's usually in people who have poor hygiene, so homeless or displaced people, people with mental illnesses, people with cognitive impairment, and even people who can't do their own ADLs. So if the hygiene is an issue, then they're at risk of lice. They are also visible with the naked eye. So scabies are hard to see, but bed bugs and lice are visible to the naked eye. And they usually feed about 5 times per day on blood. And so they're gonna be on places that they can access the skin pretty readily. So they're not gonna burrow down, they're gonna stay on the surface of the skin. So if you see lice, it's gonna be on the surface of the skin, not burrowing like scabies. And even if you see them on clothing, they're gonna hide in the seams of the clothing. They're not gonna be in the material itself. They're more likely to be in the seams of the clothing. Okay? So because of that, the places that lice tend to attack are places that the seams of your clothing will be. So it's usually on the side of your legs or on the middle of your legs where you'll have the seams of your pants, or along the waist where the elastic is, because they will congregate in the seams and where the clothing is sewed together. So you're not going to see a lot of lice in the middle of your chest or middle of your back. It's usually on the sides where, again, the seams are. Okay. Now, the clothing, there may be only, most of the lice will actually congregate in the clothing. So if you look for lice on the body, you'll probably only see 10 or less on the skin. But if you looked in the seams of the clothing of a person infected, then you'll see hundreds of them, because that's where they're going to congregate. And they feed often to survive. So if they don't get fed 5 times a day, they will eventually die out. So they need to have access to the skin. So they're always feeding. Okay? Sometimes they can introduce infections, heart disease, fever that relapses. Treatment is laundering and bathing at least once a week. So if they have a hard time bathing, if they can do it once a week, the chances of them passing on or getting lice is pretty minimal. And if you can't bathe and you can't wash with hot water and things, if you seal them up in a bag, they will also die because they need blood to kind of survive. There's oral and topical things that we use for scabies that will also help. But again, bathing is the number one thing. So those are the critters that go bump in the night, that are scary, that are blood sucking. And so in honor of Halloween, these are the things that go bump in the night.